What's up, guys? Dr. Dane here. We got Alyssa in the house. Alyssa is a competitive equestrian. She's been riding horses for how long?
About 15 years.
15 years?
Yeah.
Her background is you started riding and fell in love with it?
Yeah. And I, as a kid, just something fun to do and kind of kept with it ever since and kind of a hobby now. So.
How many days a week were you riding prior to college, back in high school?
About twice a week.
And then in college, she actually went to a specific program or a college that had the equestrian, like a competitive equestrian team, right?
Yeah.
And you rode the same thing, 2-3 days a week?
Yeah, 2-3 days a week. And then some weekends I'd show and compete. So it could be up to 4 days a week or so.
Cool. On top of riding, she has to take care of the horses at the barn, right?
Mm-hmm.
Which includes what?
Like barn work, like stall work, just general care for the horse, brushing them off, cleaning them, taking them out. So.
Yeah. And what, I guess a cool thing for the horse lovers out there, you guys develop strong connections with the animals, right?
Mm-hmm.
Yeah. You kind of have to, what do you call it? Harness their energy or make the physical, emotional connection with the horse, right?
Yeah. Take care of them and they kind of learn who you are and you learn their personality.
Yeah. So I've heard, and I don't know because I am not an avid rider, but I've heard that the riders have to develop a pretty strong, kind of emotional connection almost, right? To tame the horse. Is that what it's called?
You develop a connection with them so they kind of understand their, who they are and how to, ride with them better. So.
And all horses are different, right?
Mm-hmm.
And they have different energy and
different personalities and characters and aspects that make them special.
Aspects that make them special. And so Alyssa, back in the day, you are 22, 23?
23.
23 years old now.
Mm-hmm.
And how many years ago were you having chronic back pain?
About 5 or 6. Actually.
5 or 6?
Yeah.
And it was pretty bad at sometimes?
Yeah. I had a hard time walking.
And had a hard time walking. Ouch. Yeah. At how old? 18, 19 years old?
Yeah.
That's crazy, right? 18, 19 years old. She's an avid athlete. She's riding horses competitively. She's training 2+ days a week. And chronic back pain. Oh, not fun at that young. What did you do to help your back pain?
At the time, acupuncture, massage therapy. So.
That helped a little bit?
A little bit, but didn't really fully. So.
And then Alyssa here started working out with us over at Be Fitness a long time ago, probably 5 years ago, right?
Yeah.
She just started getting chiropractic care last year. Right now, she's kind of infrequent. We work on her every couple weeks, really. How's back pain been?
Better. Much better.
Much better?
Yeah.
Any severe, sometimes I know you get some shoulder blade tightness and some mid-back tension. How's the low back pain been, though?
Not too bad. Not as bad as the shoulder.
Right shoulder is still where you get a little jammed up at?
Yeah.
How has your technique changed on the horse since we started talking about posture and some of the leg exercises?
Definitely a lot better. I feel like I'm stronger. I have better posture and don't feel like I'm as sore after. I can even notice a difference in the horse as they ride because my balance and my posture is better.
Oh, nice. That's pretty cool.
Yeah.
So one of the things Alyssa did was she started to incorporate some strength training and some functional fitness. You guys can check out some of the other videos from Be Fitness on how we use a lot of different functional fitness equipment to improve core strength, spinal strength, and really just full body movement. And Alyssa trains 3 to 5 days a week now?
4 to 5.
4 to 5 days a week. She's over in the gym. Here in the office, she's been doing some stretches and some exercises. Today, we're going to work on her right side suboccipital region. Look down for me. And she can feel a ton of tension right through here. So we're going to say sit up tall. Tuck your chin back a little bit. Look down. And what we're working on, guys, those upper suboccipital muscles where so many people get compressed, they get tight, they get kind of squished down through their spine, especially on, if you can imagine how a horse, what's it called, trots, I guess? Canters.
Yeah.
So the horses, they kind of like bounce up and down, up and down, up and down. It's almost like a vibration machine, probably a little more aggressive and a little bit less speed or intensity. And a lot of that repetitive movement causes a lot of kind of compression up through the spine, which can ultimately cause muscle strain, joint strain, or joint sprain, irritation of the discs if it gets bad enough, which can cause radiation of pain down through the arms, down through the legs. And number one goal with chiropractic care is to centralize pain, which means bring it out of the extremities back to the spine. And once we get the pain centralized out of the extremities, we know that we're on our path to healing. And then we're going to continue more with specific spinal muscle work, adjustments, and other strength and conditioning exercises to help improve overall total body core strength and just physical fitness throughout the body. All right, so that was right side. We're going to do a little bit on the left side. And then what we're doing, just a little muscle stripping up through the neck. And definitely her right side is much tighter. She's got less myofascial restriction, less suboccipital tension, still a little bit of pressure, a little bit of tightness, a little bit of discomfort up in the neck. You can feel that's a little sore right through there, Alyssa. Look down for me. Look down. Look up, look down. Look up, look down. Look up, look down. Look up, look down. Good work. All right. So one of the things we teach each of our patients, scooch forward for me. And you guys can do this right at home. It's really simple. It's really effective. Hands back and down. We're going to get a nice kind of firm palm press into the table. And Alyssa's going to start to work throughout the day at starting to roll her shoulders open, straightening her elbows up tall. And then let's think lift the head up high, away from the hands, lean back just a little bit. And one of the things we want her to do is start to load her mid-back, start to load her triceps, her lats, her teres muscles, her posterior deltoid. And as we do this as a stretch for about 30 to 60 seconds throughout the day, she's opening up her rotator cuff, her biceps, her pec, minor and major muscles, all these guys in the front, the coracobrachialis muscles, and she's developing better strength in the back chain. She can add a neck stretch over to the right, and she can start to feel how this kind of pulls just right down through the neck a little bit. We're going to hold this for 30 to 60 seconds, and then we're going to lean over to the left, and this is going to be a little bit, do you feel that side's a little tighter? Mm-hmm. Okay, so she's got a little pool of muscle tension up through the right side of her neck. And this is going to be an exercise that we recommend that she does for maybe 1 to 2 minutes, 5+ times a day. She's going to focus on 2 things. One, rolling her shoulders open and straightening her elbows. And then she can add the neck stretch left and right for 5 to 10+ seconds per side. This is a great exercise, again, to help open the shoulders up, increase the thoracic extension, and help her throughout the day to take tension out of her neck. Cool. You can relax. See Alyssa rocking her Vivos. Vivo barefoots right here. Shoes that we recommend to all of our patients. They're barefoot or minimalistic footwear. They have a very thin sole. It's consistent throughout the shoe. I got Vivos on as well. I think that this is one of the better shoe companies that produces high quality footwear that allows your body to move in its most natural state. So barefoot wear or minimalistic barefoot wear helps to improve the intrinsic or the small muscles down in the foot, the ankle ligaments, the foot ligaments, and it really helps balance your posture out as you keep a consistent shoe on. So for a lot of our patients, we'll recommend that they get a couple pairs of Vivo barefoots so that they can rock minimalistic footwear throughout the day. And all right, so we're gonna move up into a little hip treatment with the Hypervolt. She gets a little sore, as most people do, up through the glutes, the glute medius, the IT band, origin right over here, and then just right around the hip crest, or the iliac crest, the sacroiliac joint, and the top or the superior portion of the iliac bone, which is your big hip bone. And you'll see she'll jump a little bit over some of the sensitive areas for that guy right there. Now, as I work on patients throughout the day, guys, as well, as a chiropractor, when we're hunched or bent over the table a lot, it's important as well that we kind of save our connective tissue. So you'll see I try to really focus on a nice narrow stance. I like to almost think that I'm walking on a tightrope. I double my knees open so I get into my go to double bow set stance. I keep the weight on the outside edges of my feet, and I work at my hip hinge where we bend forward through the hips a little bit, trying to keep our upper body nice and straight. We want to avoid a lot of this bending. So you'll see some other chiropractors when they are adjusting patients, they're all hunched over. Super important for us as well as practitioners to improve our own spinal and leg strength all day long as we work on clients. And I'll kind of transition between a squat stance, narrow stance, or a split stance right through here. And I'll make sure as I work throughout the day that I do this on each side of the table so that I can develop bilateral rotation out of my core. I can feel my spinal muscles and ligaments stretching as I stand in this position. And so a lot of my treatments are kind of like a workout for the patient, but they're also a workout for myself. All right, good work. Push into my hands. Stop. Push. And stop. And push. And stop. And push. And stop. All right. Ultimate goal is to get the inner portion of the foot, the medial arch of the foot, to kind of like cup right around the glute right here. Bend this left leg up. And when we do this, guys, we focus on our go-to position, which is our toes in, heels out. Push for me, which is the most ideal position for the leg. Push and stop. And where we want to improve the flexibility down the front chain. And the front chain's the quads, the hip flexors, push in my hand, the tibialis anterior, and some of the lateral leg muscles. Good, one more push. And stop. And she's pretty good both sides, left side and right side. Just a little bit of work for her. And that's where we recommend specific exercises like the go to rocking, the rocking position, or the child's pose. All right, let's go. Take a deep breath in. And exhale out, and whole way down for me. Good. Breath in, and exhale out, whole way down. One more. Good. Okay. Face over to the right side up for me. It's here, across here. Good work. Deep inhale, and exhale out, all the way down. All right. All right. Other side. Good adjustments today, girl. Yeah. Straight and bottom line. Did Dr. Emily work on you the other day too? No? Deep inhale. Deep exhale. Good. Good. All right. So adjustments to the lumbar spine, the thoracic spine. As we've worked with Alyssa before, we definitely want to work on her plantar flexion, which is her toes down, feet in like this. She's pretty tight around the ankles. In the past, we've done some muscle work on the peroneals and the tibialis anteriors through here on that lateral leg. But we are going to recommend Alyssa lays in bed at night and does some foot points and some foot squeezes down. Squeeze your toes down. Focus on your left foot and your right foot and your left foot and your right foot. About 10 times back and forth for about 10 seconds. Each side will help us to develop a stronger posterior chain, stronger plantar fascia muscles, calves. We really want to focus on the lateral calf activation. As she points her foot and squeezes her toes down, she's going to develop some increased plantar flexion down the ankles, which will help with glutes and hamstrings. Good. All right. A little sore. So we like hitting the elbows and getting some of the medial, the inner elbow pain. Thumb. Good. Some of the medial elbow pain out of the inner elbow. So we'll work on a few little pulses down into the elbow just to help reduce tension and pressure up in the elbow joint. All right. All right, kiddo. All right. We did cervical spine, thoracic spine, lumbar and pelvic adjustments. And then she can feel how she's got a little bit of pressure up in that upper right side, kind of like C1, C2 vertebrae. So one of the things we're going to do to help eliminate some of that tension is the shoulder stretch. We want to ingrain that into her brain so that she does it a couple times throughout the day, 5+ times throughout the day. And the second thing we're going to recommend is a nice little neck stretch for her, which she can also do while she lies in bed with her head on the pillow. Some people like no pillow, which I'm okay with as well. But what she's going to do, head up, over to the left. She's going to press her head down into the bed. She's going to try to squeeze this shoulder down, and she'll start to feel how this increases the tightness of the pull up into the lateral neck muscles. Turn your head to the right, push down strong through the head, and then squeeze the shoulder down. You guys can see how this group of muscles, the scalenes, the upper trapezius muscles, are just a little tight here. And do you feel that pulls up into the neck a little bit? Mm-hmm. So part of her at-home decompression is going to be to lay in bed for a couple minutes at the end of the day and just work on this right side neck stretch. She can turn her head a little bit more, press down through the back of the head, and lower this shoulder, squeeze this shoulder down. And you feel that kind of stretches right up into here. So it's going to be one of our proactive measures that we want her to do a couple times throughout the week. Definitely, if she can remember to do this every day, it will help her in between adjustments to decrease pressure, compression, irritation up into the upper right side. And then we're going to do the same thing for about a minute over to the left side. Press down through the head and squeeze that left shoulder down. And this is just a real simple, easy neck decompression. She's pushing down into the pillow. She's squeezing her left shoulder down this side. Shouldn't feel as tight as the right. You can turn a little bit, push down, lower that shoulder down. So this is her easier side, but we're going to recommend doing twice on the right. So 2 times as much on the right for every 1 time on the left. So she can start stretching her right side neck first, her left side neck second, and then back over to the right side neck. That'll help as we work on her adjustments in here, as well as when she's out of the office and she's doing her physical activity, whether it's weightlifting, functional fitness, or horseback riding. When she starts to feel the neck tighten up, she can start to proactively kind of like reduce the tension up in her neck by doing this simple stretch. All right, let's roll to your right and then sit up tall. Bend up here. All right, kiddo.